Rabies cases on the rise in the Ashanti region as Ghana records 152 human rabies cases in the last 12 months.
Every year we were recording around 752 dog bites. And considering Ghana being a place where over 50% of our population live in rural areas where dog bites are not reported, even what I'm saying here about 700 and something is very, very low if you compare to what the real situation is. And during the period we had 102 human rabies that were confirmed.
And as Ghana joins the rest of the world to mark the day, what signal does it send and how right are we getting it protecting people against the disease? This is today's big story. According to the Ghana Veterinary Medical Association, 752 dog bites were recorded in the last 12 months, out of which 152 human rabies were confirmed. The report also indicates 40% of people who were bitten by suspected rabid animals are children who are less than 15 years.
Rabies is very endemic in Ghana. And when we say endemic, it means it is living with us. And so we need to do something about it. If we cannot eradicate it, we need to do something about it to ensure that we reduce it as much as we can. We, as members of the Ghana Veterinary Medical Association, would like to use this forum to state our position. And our position is that we need to do all that we can. And today, I am calling on the Ministry of Agriculture, the Veterinary Service Department, for us to find a way of conducting nationwide rabies. And it must be free, it must be compulsory, and after we have finished it, there should be run-ups. And when I say run-ups, what I'm talking about is all dogs that have not been vaccinated must be eradicated. Every year we were recording around 752 dog bites. And considering Ghana being a place where over 50% of our population live in rural areas where dog bites are not reported, even what I'm saying here about 700 and something is very, very low if you compare to what the real situation is. And during the period we had 102 human rabies that were confirmed.
And Dr. Osei Bonsu is the president of the Ghana Veterinary Medical Association. Welcome to our studios. Now,
thank you, Brian.
What are we doing wrong?
What are we doing wrong? Before I start, let me say good evening to your cherished listeners. And Brad, what we are doing wrong is simple. Rabies is a disease that can easily be controlled. Unfortunately, the will, I would say, is not there. And because the will is not there, anytime you mention free anti-rabies campaign, people turn their backs to you. All that needs to be done is getting rabies campaign conservatively for a period of about 5 years.
Where is this interest from? People you don't show that interest. Where is it from?
The interest is those that are supposed to sponsor whatever that need to be done. And at this point, I'll call on the Minister of Agriculture, who is, the overseer of the Veterinary Services Department and the Veterinary Service Directorate, for us to find the money. Because to me, even if one person die out of rabies, it's outrageous.
So funding is a big issue here.
That is the main issue. Getting rabies campaign for free. And the cost is not too much. Now we are talking about a dose of vaccine costing about between 1 to 3 cedis, and maybe a little bit of some logistics. But we've been talking about this for years. The last time I know we have nationwide campaign was 1997 to 1981. After that, we have never been able to do that. And the position of the Ghana Veterinary Medical Association is simple. That wherever that money is, because rabies, you have to get it and do it, because rabies is becoming, a menace.
Let's talk about the figures
in the country.
The figures now.
Yeah.
We'll come back to talk about how dangerous it is, how disturbing it is. But the figures, so we're told that we are recording between 150 cases. Is that right?
That is correct. In Ashanti region alone, not the whole country. That is in Ashanti region alone. I know Greater Accra may have more than that. I don't have all the figures in the regions on my fingertips. But I know that Greater Accra is the biggest, followed by Ashanti region, and maybe the other, regions. So thinking about having over 152 cases in the Ashanti region alone tells you how big the situation is.
And this is what is worrying. Now, if the Ashanti region is recording that figure, you think that Greater Accra could be recording more than that?
Yes, because normally the urban centers, because of a lot of people use dogs as pets. Some use them as watch dogs, and we have a lot of stray dogs also roaming around. So in the cities, we normally record more than in the villages.
You talked earlier about the fact that the difficulty is getting the funding. Now, what quantum of funding in terms of money are you talking about?
Well, I can not say exactly how much we need, but like I was telling you, if we have even 1 million dogs, assuming that which we don't have, very good data that I can tell you for sure how many dogs we have in the country. Even if you have 1 million dogs and each of the vaccine is costing 1 cedi, that is 1 million Ghana cedis, and a few logistics like syringes and needles that will go around. After all, you are going to use staff of the veterinary services who are already on the ground, and if you spend even 2 million to do this per year, to me, that is nothing compared to the lives that are being lost every year, And to us, the situation is serious. And at times I get emotional when I'm talking about rabies. You get emotional
because you don't get that response, that support from government.
Exactly.
Where would you want to put the blame? Is it because we do not think that rabies is a dangerous disease, or you think that the money is simply not there?
I think that the people that are responsible know that rabies is dangerous, but because maybe it has not fallen on their door gates, they don't see it. Normally when such a thing is happening and it's happening in front of somebody's doors, you don't appreciate it.
Right.
But if it affects you, for example, you have a child going to school, and on her way, a dog is biting her, and after maybe 3 weeks or 4 weeks, the child gets fever, and you take the child to hospital and started showing the symptoms. And if you have just seen one case of human rabies, you know what I'm talking about. And if somebody that is, listening to us who have, the powers, has got one of the children go through this. I think wherever the money is, you have gotten it. But I believe strongly that it is because it sounds as if it is too far away from us. But what I want to caution is that rabies is not far from anybody, because the dog that gets rabies may not even bite the people, the owners, because they get out and they are roaming around and they meet you anywhere. Maybe you are in your nice car, air-conditioned car, and you park in a car, and somewhere, and you want to get out, and the dog rushes and bites you. It happens.
It happens every day. Let me speak to the Ashanti Regional Director of Veterinary Services, Dr. Kofi Kwansa-Filson. He's the Director of Veterinary Services in the Ashanti region. Now, Dr. Filson, thanks so much for your time. First of all, tell us, we're told that the Ashanti region is recording about over 150 cases. How serious is the case in the region?
Thank you, Bright. The problem in Ashanti region is that we have the incidence of dog bite cases on the rise. We have monitored for the past 6 years, and we realize that the reported ones, the dog bite cases that are reported at our veterinary, what we've realized is that the reported case that we have in our veterinary facilities are on the rise. And then what we're seeing is that these dog bite cases are linked to human rabies if these issues are not correctly diagnosed. So what we are planning is that we want this anti-rabies campaign, which used to be the case in about 10 years ago, to be reintroduced so that we can protect the dogs, so that human beings will not get infected at the end of the day.
And so let's talk about efforts at trying to reduce the numbers. We're talking about a general lack of funding as a problem for the whole country in fighting rabies. Is the Ashanti region better?
Yeah, the Ashanti region is not different from any part of the country, because normally it's the veterinary services personnel or the veterinarians that go about vaccinating dogs. But it is also the responsibility of pet owners to bring their dogs to our facilities for them to be vaccinated. But unfortunately, people are not bringing it because maybe the distance that they have to travel to bring these dogs to the facility. So what we are planning, or what we want the government and then all of our stakeholders to do, is to find a way so that we set up a period called the campaign period. We'll intensify sensitization, and then we could move closer to the community so that dogs and cats could be brought to be vaccinated.
Are you therefore suggesting that perhaps sensitization has not been done well enough?
Sensitization has been ongoing, but I think it's on the quiet, because we are not making the big noise that are made. We have it on the radios, in the communities using the public address system. That's one. The funds have not been available for that to be done. What is being done now is people coming to the offices, and then we're telling them, and then the few staff of veterinarians scattered in the district also visiting farmers and telling them. But that is not enough, because we are confronted with a big challenge that we need to mobilize and then make a lot of noise about it, so people know that they need to come forward so that we protect society.
Let me ask you this. Do you think that the individual's behavior towards rabies perhaps is responsible for the high figures we're recording?
Individuals, the cases that we are reporting from Ashanti region, they are coming from the rural setting. And the burden, the difficulty that the average farmer faces in this country. So there's a need for us to make a concerted effort to really get nearer to them and then repeat these messages that rabies is preventable. Rabies, you just have, once you vaccinate your dog once every year, you are somehow protected. So that is the challenge. We are making the noise, it's not enough, and that there were people who have dogs have rare challenges in moving the pets or the dogs to our facility.
And that you think that it can be reversed if we increase sensitization and perhaps get the funding from authorities. How hard, for instance, has the Ashanti region been fighting, especially with regards to the high number of cases, been fighting in perhaps getting funding to embark on your campaigns?
Ashanti region, what we have been doing is that as we move around, we meet the district chief executive, the district assemblies, we tell them about it. We tell them there's a need for the district assemblies to support rabies vaccination as a major project. But you realize the response is a bit low, maybe due to I would say, maybe the financial disposition of the district assembly. So what we are saying now, there is a need for all of us, wherever the money is, let's take it and bring it on board and then push it. And once it's running and being spoken of all around the area, people will bring their dog and then we'll have success. Because we've done it in this country before. When we were having these rabies campaigns and this, rabies was not a problem at all. But here we are 7 months into this year and we already have four children gone. So this is the situation.
Finally, before I let you go, now you are suggesting that if we increase the funding and we increase sensitization, we're likely to see a reduction. Now, the funding, as you earlier said, is not coming. Does it therefore suggest that we might see more cases before the year ends?
Yeah, it follows. That's why we are sounding the note now. Because the rate is coming. Figures we are giving you is the reported one. But there are many more that have not been captured because they don't report. So we need to go in aggressively and then make sure that we cover all this so that our people, especially those in the rural setting, could be covered. Because the deaths that are coming, you find that it's from maybe a village somewhere that the person doesn't know. Let me tell you a story that there was a place where a cat, rabid cat, they had a rabid cat, and it was moving around, and people thought it was something, it was magic, and they would surround it and even be clapping and watching it. So, meanwhile, this cat has bitten about 3 or 4 people. So then, sensitization is good, but we have to really have funding to move up and then spread the whole thing across the region and possibly across the country.
Right, thank you so much. Dr. Kofi Kwanzaa-Filson is the Director of Veterinary Services of the Ashanti region talking to me. Let me come back to the studio. Dr. Osei is the President, is still around. Now, Dr. Kwanzaa-Filson's comment then shows that if we don't do the right thing, we will see more cases before the year ends.
Definitely, but before I even go, let me quickly say that the importance of vaccination,
right,
or the importance of dogs is not the ones that have owners. The most important ones are those roaming around.
They are the danger
they are the
humans.
Most dangerous ones to humans. And how do you get rid of those ones? That is where the rabies campaign comes in. The moment that we get the funds and do the rabies campaign, and then we tag them, we have a color that we put around their necks. The moment that you do that, then you have identified the vaccinated ones from the non-vaccinated ones. Then you set out, you can then impound on all those that are running around and get them and destroy them. That is the essence of rabies vaccination. And the moment that you are able to do that for 2, 3, 4 years, you are likely to get rid of all the stray dogs roaming around. And for those ones that are staying with their, owners, it's very easy to get them.
To get them vaccinated,
yes.
right.
So when we are talking about, to me, it is not even those ones are not the problem ones, because if you do the sensitization, they will bring them for them to do that. But what about the stray dogs that have no owners?
I'll come back to you to talk more about this, but let's go to the public. A lot more of you have been talking about this. We've been trying hard to get the Ministry of Agriculture to react to the fact that funding for rabies campaign is not forthcoming, and that is dangerous because 152 cases in the Ashanti region. It could get worse if the funding doesn't come in and we are unable to reach them, but we're also trying hard. But a lot more of you have been adding your voice to this particular issue of keeping rabies in check. Let's watch and listen to what you have to say.
I know of rabies. It's very dangerous and scary. I have a dog. By cleaning it every day and giving it food every day and vaccinating it every month.
There's an infection from dogs to human beings. If a dog is suffering from rabies and it gets maybe bites that is in the human being, then the person becomes infected. The person sometimes behaves like a dog, grows lean, and if care is not taken, and with the physical appearance of the person, you say the person is suffering from HIV/AIDS, which is not so. But with the backing, that will let you realize or know that the person is suffering from rabies.
Friends, Yashamra, Efa, and Krama, freezer, if you are phobia, and Krama be a wura. Na ne Krama, sir, or deliver 2 kg. And now, sir, some panena, your bono, or boni be. Now, even though class your bon and panena crana, Yariane bar. I say, you see, you cook Krama and only see no.
What I know about rabies is, first, normally I was having a cat in the house. And the cat started that she was just even inviting people. As soon as you just even step on her, she will bite you. So I was in the house and I was thinking about it that I don't even know. So I went to a veterinary and I asked. And they said the cat was just even infected about rabies. So I took her to veterinary, then they injected her. As for there, I haven't seen anything.
Well, we must be vaccinating our dogs against it. And if a dog is not maybe not vaccinated, it shouldn't be allowed to be walking on the street. Yeah, I really have a dog. I have dogs. Yeah, we vaccinate them. It's usually done annually because there's a public. This information vans will come and make a public announcement that dogs must be vaccinated within this period. So from that period, we used to go and vaccinate our dog, and they'll be given either a tag on the neck or some small chain. Yeah.
As for the infection, normally in Ghana here, we are having most of dogs, cats, any animals. But here, we don't even control them. They're just even moving around. They will go to every bola to eat. Sometimes they will just even go. Sometimes they can even just go and took someone's feces and took it. Maybe the person is having an infection of something. Yeah, we have to just even prevent our dogs and our cats. We will just even lock them. We will put them into cage and lock them.
Right, some of your comments on the disease rabies there. Now, Dr. Bonsu, you might be excited because a lot of the people know about it. What is left is for the veterinary services to reach them and make sure they do the right thing.
Yes, I'm very excited listening to what is going on. You can easily see that a lot of people have knowledge about it, even though some of the knowledge that they express may not be fully the right ones.
Right.
But all that we need to do is now to do what as professionals we are expected to do. And that is what it's like. The public may have all the knowledge that they have, but if we don't do the right thing, we cannot protect them.
And have you tried hard to get the Ministry of Agriculture to listen to you?
Well, we are still talking, we are still making noise, and we thank you for this opportunity. I think it goes a long way.
We're trying hard to get to talk to them, but we're not reaching them.
We are very excited that the media, especially today when we are having our meeting, the number of people that came, and we hope that we will not end it here. You make a follow-up. Let's make noise about it. And I know that wherever the money is, they will find it. So that we will do the right thing to save people, because it is actually terrible. I wish you had an opportunity. We have a film that we could have shown to people.
Right.
But WHO prevents us to do that because of the horror that it will show you. So because of that, it's only the media men that we show them for them to see and
the
appreciate
dangers of the disease.
The dangers and how terrible it is, especially when somebody is infected and is dying. You know.
Right, we'll have more time to talk about it. Dr. Osei Bunsu is the president of the Ghana Veterinary Medical Association, and he's been telling us about the dangers of rabies, the fact that funding is not forthcoming to increase awareness creation to reduce the figures we're recording. Ashanti region recording over 150 cases, and he's saying that the Greater Accra region could be recording more. We have more right on this very issue later on News at 8, but for now, the first part of the show is grinding to a halt, and the second part that is about you is starting very soon with Marian. Stay with me right there. I'm coming back in a moment.